the NHS wants to focus more on the personalised element of care and giving everyone, or that's the sort of policy direction, I suppose, giving everyone the time and the attention they need. There's obviously constraints around resource to be able to do that. And the other objective of integrated care is population health. So looking out for needs across a population level. To me, there's a bit of a tension there between the personalised bit and the population bit. What do you think are the main challenges in being able to focus at both ends, and how can that be managed?
Well, I suppose they're done by very different groups almost. So the personalised care I always see is about that interaction between an individual clinician and that patient, or a group, a team, and that patient. So that's very much in the now. What do we need to do for you? The whole population health thing is really about saying, so actually let's look at the needs of our entire population. I think where it gets really challenging is there's a real risk then that you say, well, actually, you know what, 80 or 90% of our population need X, so that's what we do. And the problem with that is it's the 10 or 20% that actually are the complex people who will end up using the service to quite an extent. And they either get lost and just fall out of the system completely, or like I say, they really start using the services and then they get labelled as using the services inappropriately. So the real challenge, I think, on a population health basis is really understanding that population to quite a complex level and designing the 80% for the 80%, but making sure that you have that special approach and service for the people that will find that difficult. Certainly when I was in Healthwatch, a lot of the work that we did was around when somebody didn't fit that box. So there was something that just meant that whatever was the normal route wasn't right for them. And they would then just get, computer says no, and they'd just get rejected from the system. And that's when things started to go wrong and people started to get upset and angry, complaining and all that type of thing, because computer had said no, because the computer algorithm's not set up for them and their particular circumstances. And they weren't able to flex, because I think a lot of us, we can, you know, we go, all right, well, it's not perfect, but I can handle that, I can cope with that. But this 20% tend not to be able to change and flex.